All right. Good morning, everyone. Thank you all so much for being here. I'm San Francisco Mayor London Breed. I am joined today by the Director of the Department of Public Health, Dr. Grant Colfax, the Director of the Department of Emergency Management, Mary Ellen Carroll, the Director of the Department of Human Services, Trent Rohr, the Director of the Department of Homeless Services, Abigail Stewart-Kahn, as well as the Director of the Department of the MTA, Jeff Tumlin, the Police Chief, Bill Scott, and we have a special guest today from the Interfaith Council, Michael Pappas, who will be speaking directly after my comments. As of today, we have confirmed 676 cases of the coronavirus, and sadly, 10 people have passed away as a result of this disease. This is clearly a really challenging time for San Francisco. And what we have done time and time again, especially during this press conference, is to reiterate the importance of staying at home. We know that a couple weekends ago, we had some real challenges with that. And as a result, over the past 2 weekends, people have complied and have been wonderful. But we also think that weather might have played a role in that because it was raining and it wasn't as nice as it probably will be this weekend. And I just want to remind people it's important to really maintain our physical distance when we're out in public, that even though we may need to run errands, we may need to take walks, and we're hearing about a lot of data that indicates the early signs that San Francisco is in a decent place. The fact is, we need to be mindful that this virus is out there, and we cannot get comfortable. We cannot get complacent because as well as it may seem like we're doing, as you can see, those numbers are still going up. And we anticipate that they would be even higher, and the worst is yet to come. So I just want us to be mindful of the need to continue to follow the stay-at-home order and please comply. It's been almost a month, and I know people are feeling a little anxious and frustrated and wondering when are we going to get back to the normal as we know it. I just want to reiterate that unfortunately now is a time for sacrifice, and the sacrifice is for all of us to follow the order so that when this is over, we can look back and look at the number of lives we possibly were able to save as a result of following the order. So I just want to reiterate that and talk about a couple of things that we have planned for the coming week, as well as provide you with some important updates because we know that this is a very challenging time. Not only is it challenging for people physically because of our concerns about the virus, but it's also having, I know, an impact on the mental health of so many people. Our first responders are folks that we want to make sure are well taken care of. And we know that they're working long hours under an enormous amount of stress. And what I've reiterated time and time again to people who especially are out there on the front lines and working for the city, it is important that we are doing everything we can to take care of the public, but we have to make sure that we take care of ourselves and we take care of our mental health. One way we are supporting the health of our first responders and other frontline workers is through efforts like City Test SF, our new COVID-19 testing facility, which opened this past Monday. But it's not, as I said, just about physical health. We also need to provide the necessary mental health support. So today, we're announcing an expansion of mental health resources for our first responders and other city employees. We will now be providing 24/7 one-on-one counseling for any first responder or any city employee who is in need. If employees require long-term mental health counseling, they will be connected to mental health professionals provided by their healthcare plans. Our firefighters, police, sheriffs, sworn officers, and 911 operators will have access to a customized app on their phones, where they can easily connect to this program and other mental health resources. But it's not just enough to provide that support to our first responders. Our healthcare workers are under an enormous amount of pressure during this global pandemic, and we need to do everything we can to support them. Today, we are launching a new program called Heal San Francisco to support healthcare workers throughout San Francisco. Heal San Francisco will provide free mental health services for public, private, and nonprofit healthcare workers in partnership with the Bay Area chapter of the COVID-19 Pro Bono Counseling Project. Licensed clinicians are volunteering their time during this crisis to support frontline healthcare workers. Healthcare staff who are interested in Heal San Francisco should speak with their supervisors or their HR departments. They can help you sign up for this program. And I also like to, again, take this opportunity to just really encourage people to take a moment to make sure that you are taking care of yourselves, taking care of your families, because we know that this is having a tremendous impact on people's public health, but also just in general, mental health plays an important role in that. And so we need to think about ways in which we can be positive, we can be supportive, we can be encouraging during this time, because we all are going through this and we are in this together. On Monday, Dr. Colfax spoke to our efforts to increase capacity in our hospitals. And we have increased our capacity. In fact, in our intensive care unit beds, we have increased our beds by 91% in our ICUs to a total of 530 beds. We started off with 200 citywide, and now we're at 530. And our acute bed care has increased by 52%. We're up to 1,608 beds total. And while we're preparing our hospitals for this pandemic, we know all of our communities still need to access care, including communities that are traditionally underserved, because we know that we can't just neglect other healthcare needs that we know people are experiencing. Yesterday, we opened our first field care clinic at the Southeast Center in the Bayview Hunters Point community. This location will serve the surrounding community. It can serve up to 100 patients per day, providing primary care, urgent care, and screening for COVID-19. I want to be clear, screening, not necessarily testing, but the screening could provide an opportunity to make a recommendation for testing. So I think ultimately we want to make sure that if you are not feeling good to a point where you need to go into the hospital, this is an opportunity to go to a local clinic and to get the help and the support that you need. Depending on the urgent care needs and the extent of the hospital surge, we can mobilize up to 3 additional field care clinics near existing healthcare centers as standalone sites. So our goal is to not just stop at the Bayview Hunters Point community. We want to provide clinics all over the city because we want to continue to reduce other services in our hospitals. Field care clinics will help reduce the number of patients needing to go to the hospital, urgent care and emergency rooms, which will help keep our hospitals focused on COVID-19 patients that we all know need to be served. Another need we have in some of our communities, as we know, are definitely more public toilets. We have a lot of people who are still, unfortunately, struggling on our streets right now, and we have fewer places for them to use the bathroom, especially since so many locations are now closed. Starting today, our Public Works Department will be deploying the first 5 of 15 portable bathrooms and hand washing stations in the city. Public Works work with the Department of Homelessness and Supportive Housing to identify the high needs areas in the Tenderloin, the South of Market, the Bayview Hunters Point, Castro, and the Mission neighborhoods. These bathrooms will be open 24/7, so everyone can have access to a bathroom and keep their hands clean as part of our efforts to prevent the spread of this disease. And I want to thank Urban Alchemy, who will be staffing these bathrooms, for continuing their work to support public spaces. Urban Alchemy is an incredible program. They are the folks who are monitoring all of our public restrooms, and they have extended their capacity to help us during this crisis. These bathrooms, as we know, are critical for both making sure people have a bathroom to access and helping us to keep our streets clean. Our public works street cleaners are out there every day, and I want to take this opportunity to thank them for cleaning the streets, to thank them for continuing to empty the trash, for thanking them for continuing to respond to the 311 calls where we know there's illegal dumping and other issues, for power washing the sidewalks and all the work that they're continuing to do every single day. The hardworking men of the Public Works Department, they're doing everything that they can to keep our streets as clean as possible. So thank you for your service. Yesterday, we launched a new COVID-19 data tracker that greatly expands the amount of information that we're able to provide to the public. As we've said from the beginning, that the decisions we are making are based off the recommendations of public health data and science. It's important that we try and be as transparent as we can with the information that we're using to make the decisions that we're making. And that the public can see the effects of those decisions. This information is hosted by Data SF website, and you can find it by going to datasf.org. And Dr. Colfax will provide an overview of this information, and we will continue to add to this platform so that we can provide as much information as possible. And I do know that people want to know what's going on, who has been impacted. People want to see the data. They want to know what is happening. And many of you know that the challenges we have with public health have a lot to do, the ability for us to provide information has a lot to do with privacy laws around someone's personal health care. Dr. Colfax will talk about that a little bit more, but as much information as we're able to share, we will share that information with you. But in the meantime, there are a lot of tools that are being created out there, and one of the tools that I personally started using is called How We Feel. It's an app that I uploaded on my phone, and it tracks data, and I basically log in every day. It asks me how I feel, it asks me about my activities, and it also locks in my zip code. So this is really a tool that could potentially help. Johns Hopkins University is facilitating this tool, and it helps to potentially predict, based on zip code, the next hot spots as it relates to the coronavirus. So it's a tool that I'm using. I'm sure there are other tools out there, but I highly recommend it because the more people that we are tracking and we know what's going on, the better we can identify locations and figure out where there might be challenges in the future. So that is just something I think will be a great tool to help us track this. I also want to just say that as I mentioned in the beginning of this press conference, that although we know that the early data has been very encouraging so far, I want to just again reiterate that we are not out of the woods. We are not in a place where we can get comfortable. San Francisco is, as you know, receiving praise from all over the country. And people, governors, mayors, and other leaders throughout this country have reached out to me personally to ask a number of questions about some of the programs and the things that we're implementing because we were one of the first cities in the country to move forward with a stay-at-home order. And while I'm proud of what we have done, we just can't let up. We can't get comfortable. We can't get complacent. We still have a long way to go. And I just, again, want to reiterate how physical distancing ourselves from people, as hard as it has been, is necessary. It's necessary to deal with this pandemic. And I know that a lot of time has gone by, and I know that people are starting to feel, again, anxious and uncertain and frustrated. And I just want to remind you that this will pay off and this too shall pass. We also know that this upcoming weekend is Easter Sunday, and tonight we celebrate Passover. So for people who are religious, who are spiritual like myself, you know, every year, ever since I was a kid, Easter was the holiday that I looked forward to the most because, as a kid, it signified not only the end of the rainy season, it also basically signified a new beginning, the spring, the sun was coming out, we were going to be able to go outside to play, we were going to get new dresses for church, and so many great things. It brings back happy memories of Easter basket, fun and family and food and tradition. And so I know how hard it is for people who are religious, for people who are spiritual, as they celebrate this time, this very significant time, how hard it's going to be for many of you to basically stay at home and not go to church on Sunday. And it's hard for me not to do that as well. And so I want to just impress upon you, this is the first time this has ever happened to any of us during this time. And there are other ways in which we can celebrate. I know that many services are doing online service. I know that many pastors and a number of priests and folks in our religious community, they're reaching out to their congregations, and they're also connecting members of the congregation with other members of the congregations who may not have access to social media, so that they can check on their members of their congregation and make sure they're getting the food, the support, and even the conversation or the prayers that they need. So I just want to reiterate how important it is, as hard as it will be to stay at home on Sunday. It is necessary. It is necessary for not only your own personal health, but also the health of the people that you love, especially when you think about many members of our elderly community, those who are the most vulnerable. We want to make sure that we do everything we can to protect them. And the way that we protect the people that we love and care about is to stay home and follow this order and to continue to uplift one another with our prayers, with our good thoughts, with our phone calls, with the things that really can help get us through this very, very challenging time. And so we're in this together, as I said, and part of being in this together means that we take the responsibility for one another to support and to uplift and to look out for one another. So I am just really asking so many of the leaders of our religious community, continue to do your very best to communicate to your members how important this is. And I also want to just go back to something that just happened a couple weeks ago that I read in the paper about a church in Washington State where 45 members of the choir came together. They had a choir rehearsal where they practiced social distancing, and as a result, sadly, not only did 45 members of that choir get diagnosed with COVID-19, 2 people from that choir passed away. And we want you to understand that, this is really why it's important that you stay at home and that you look for religious services on television, reach out to your congregations, and try to do what we can to make sure that people who traditionally would want to and would definitely be at church this Sunday during this very holy time for so many of us, that is not the case. We are here to uplift you. We are here to continue to pray for you and to support you. And we just ask that you follow the stay-at-home order because this is going to be so critical to the public health of not only you and your family members, but the rest of the city. And here to talk a little bit more about, the religious community and someone who's been an incredible leader and someone who's brought together different faiths, because regardless of what faith we're a part of, we are still a part of a religious community that puts love and puts support ahead of everything else. And we come together to offer prayers and to offer support during this very difficult time for each and every one of us. And I've heard so many pastors and priests and others say, well, this is the most important time. As we're going through this pandemic, this is when, you know, when we need each other, when we need prayers more than anything else. And there is a way to continue to do that. And the Interfaith Council has played a vital role in helping to bring together our spiritual community, but also helping to reach out and push for that message and to make sure that people get the help and the support that they need. And so here to speak on behalf of the Interfaith Council is the Executive Director, Michael Pappas.
Thank you very much, Mayor Breed, for this invitation to address San Francisco today. But also I want to thank the mayor on behalf of the 800 communities of faith and religious institutions in the city and county of San Francisco for her leadership in very early on addressing and responding to this COVID virus. There is no doubt that numerous lives have been saved, and we have become a model for the nation as a result. I've been thinking deep and hard about services, and in each of our services, it's an age-old ancient tradition. We pray for our civil authorities and those who protect us. Those words have never had more meaning than they have now. And so I want to thank the mayor for her leadership. And, you know, we are not only just praying, but since the declaration of emergency was enacted and the community branch was activated, the San Francisco Interfaith Council works arm in arm with the city to make sure that our leadership in all of our different houses of worship are apprised of up-to-date information, aggressive recommendations, and public orders from Department of Public Health on what needs to happen. And I want to just commend the faith leaders of San Francisco for very quickly pivoting and closing their church doors, closing their mosques, and closing their synagogues and temples, and using the best that technology has to foster community in the midst of isolation. In addition to this, they have been reaching out personally by telephone to their congregants. And this is significant because their congregants are some of the most vulnerable citizens in our city and county. So we are ambassadors of the city to help in this emergency and this public health crisis. I would like to say also that, and to reiterate the importance of staying home. We are entering into these most holy days for the Christian and Jewish community, but also in very short time, the Muslim community, which will enter into Ramadan. The importance of worshiping virtually is something that we need to stress. The San Francisco Interfaith Council has been harvesting, compiling, and making available to our greater communities a particular link where all can access online worship, and that would be at sfinterfaithcouncil.org. We would encourage you to go there. We would encourage you to join your communities at worship during this season. We know that this season will always be remembered in the years to come, and I just want to express my gratitude to the many faith leaders who are on the front lines with some of our most vulnerable residents in San Francisco, ministering in a way they never imagined to. I also want to make a small confession. some weeks ago when I heard that people were encouraging people to go to worship on these holy days, I was troubled, because I think that in doing so, you put at risk the welfare and the health and the safety of those who are entrusted to your care. I am just so pleased that here in San Francisco, without exception to my knowledge, that I have not heard of one community of faith who is encouraging that. And I just want to wish you all a very, very blessed Easter and Passover and Ramadan. And may God bless our world, our nation, and our city. And may God bless our mayor. At this point, it is my distinct privilege to introduce the Director of the Department of Public Health, Dr. Grant Colfax.
Good afternoon. I'm Dr. Grant Colfax, Director of Health. Thank you, Mayor Breed and Executive Director Pappas, for your support. I'd also like to start by thanking everyone in San Francisco for their cooperation, your sacrifice, and your community spirit. As we join together, we are helping fight the spread of the coronavirus. When you stay home, when you stay 6 feet apart from people, when you wash your hands, and when you cover your nose and mouth with cloth, you are literally saving lives. I would also like to update San Franciscans and others today on a few developments in our ongoing work to respond to the coronavirus and protect our community. I usually begin these updates by summarizing the number of cases in the city and some key data points. Today, I am glad to be able to share this information using a new tool that we have created for the public. The San Francisco COVID-19 data tracker went up yesterday. It is a new online resource that will provide daily updates of key data that describe the impact of the coronavirus in San Francisco. Data are an important tool to help San Franciscans see the picture of the coronavirus in our community. This knowledge will help us all do our part and see over time how the situation is changing. Our data analysts have been working tirelessly to collect information from across the city and create accurate, I want to stress accurate, reliable reports to help guide our decisions and inform the public. The Department of Public Health collaborated with the Controller's Office, Open Data SF, and the Department of Emergency Management on the new data tracker, and I want to thank all of these colleagues for their hard work and support. The tracker features information about cases, demographics of patients, hospitalizations, and testing. We will add more data elements, and they will be updated as we gather more information and continue to improve the tracker. Let's review the tracker now and go to the first slide. As you can see today, there are 676 San Francisco residents with confirmed cases of coronavirus, out of a total of 5,994 test results reported. We will get into the testing patterns in just a bit. Sadly, 10 San Franciscans have died from the disease. I would like to send my condolences on behalf of the entire department to their families, loved ones, and friends. Now, we will continue to walk through the tracker. The report shows clearly that cases have been rising steadily since our first 2 cases were confirmed on March 5th. So from March 5th to the data that we are presenting today, we've had dramatic increases in cases. I expect these increases to continue as coronavirus continues to spread throughout the community and as we increase our testing capacity. The more we test for the disease, the more we will find the disease. We do not know yet when we will peak. I would also note that San Francisco has had no cases from travelers, which was such an early focus of the global coronavirus outbreak back in December and January. Instead, the clear majority of cases are from community contact. This tells us and reinforces vitally how important it is for us to continue to stay at home and practice physical distancing. This is one of the most important public health interventions we have. This is a vital tool. Please continue to socially distance. Now, let's move to slide 2 with regard to testing. As you can see on this slide, we have tested nearly 6,000 people in the city to date. We started with our own public health lab here at the department on March 2nd and have steadily added capacity at the Zuckerberg San Francisco General Lab, other hospital labs, including the Chan Zuckerberg Institute and UCSF labs, and other commercial labs. We have developed great partnerships to ensure city workers and first responders are able to be tested quickly. What's interesting here is the jagged line that shows the percentage of tests that turn out positive. So far, we are averaging 13%. And it's very important on this graph to look at the trend over time. One day of a high or low positive result is not the information that is vitally important here. It is really looking at the trend over time. Let's move to slide 3. This shows hospital data. This is important information that I study carefully. The number of cases in the hospital and the number of those in intensive care is the best indicator of how our healthcare system is going to be strained. Here we see the number of patients with coronavirus in hospital beds across the city. This tracker includes data from 9 hospital systems. The tracker shows that there are 83 people in the hospital with diagnosed coronavirus. Roughly half of those are in the intensive care unit. The reason this information is so important is that it shows us the sickest people, those who are most in need of care. It also helps us measure the expected surge of hospital patients. And you can see that there has been an increase since the data have been assessed. Not perhaps as rapidly as some other jurisdictions, but still a steady increase in numbers of hospitalized patients. So far, the numbers continue to go up, but they haven't been rising at a rate faster than we can handle. I encourage all San Franciscans to consult the data tracker and see how we are doing as a city. Working together, we can flatten the curve and slow down the spread of the virus. But it is still a rapidly changing situation, and we cannot be complacent. We must continue social distancing. We must continue to remain resolute in this work in order to not see a dramatic surge of cases in our community. This virus will take off otherwise. I mentioned hospital surge planning, and every day that we prepare is a good day. All of our San Francisco hospitals are working together to expand capacity and empty beds to make room for more patients. Just yesterday, as the mayor mentioned, we opened a field care clinic in the southeast part of the city to ensure that residents there can continue to get urgent care while keeping hospitals' urgent care services from getting overwhelmed. This field care clinic is an extension of the Southeast Health Center, one of our vital primary care clinics in our Department of Public Health system. The clinic will be open to the neighborhood and over time may expand to treat people from throughout the city. It is part of our hospital surge planning, and we have plans to open up to 3 more clinics like this if they are needed. As we continue together to fight the coronavirus pandemic, I would like to remind all of you that our top priorities as a community are reducing the spread and slowing the spread of the virus in the community, protecting vulnerable populations, healthcare workers, and first responders, preparing our health system for an expected surge of hospital patients, and expanding testing capabilities. In all of this work, we seek to continually do better as we incorporate the latest science, data, and facts into our actions and recommendations. We are working quickly as possible, to integrate new information all the time and adjust our recommendations accordingly, so we are providing you the very best and most up-to-date data and advice that we can. Now, I would like to provide an update on Laguna Honda Hospital and the steps we are taking to protect residents and staff. We now have 17 confirmed cases of coronavirus at Laguna Honda. 13 of the confirmed cases are among staff and 4 are among residents. Of the staff, 10 have been in patient care positions and 3 have not. All 4 positive resident cases are in the South 5 ward or neighborhood. We retested the residents of South 5 this past weekend and received only 1 positive result, which brought our total to 4. We also tested all residents in the South 4 neighborhood on Monday and have not received any positive results yet, though some of those results are still pending today. Staff retesting on both units is continuing today. Overall, to date, 298 Laguna Honda Hospital staff have been tested either by the Department of Public Health or their own healthcare provider, and 208 residents have been tested. As part of our ongoing outbreak response, we continue to test staff and patients throughout the hospital who have been identified as being exposed through contact investigation or show symptoms of the virus. Unfortunately, we do expect more positive cases, but it is crucial that we know the facts so we can take evidence-informed action to preserve the health and mitigate the spread of the virus in the institution. We are working hard to keep our residents, their families, and staff as supported and updated as possible. This weekend, we launched a daily update via phone for residents and families. When residents or families call, they will access a pre-recorded COVID-19 daily update. It will be updated every day, 7 days a week at noon in multiple languages. It will include the number of cases, the units under quarantine, and other key operational changes we are making to limit the spread of the virus. I encourage families and loved ones to call for these updates. The number is 415-759-2190. This is a very challenging time for our Laguna Honda staff and residents. We will continue to provide extra resources to support staff and residents coping with the impact of the outbreak. For example, Laguna Honda chaplain Bob Desai is available for spiritual services and guidance for staff and residents. We have opened a dedicated phone line staffed by Laguna Honda psychiatry clinicians who will provide emotional support to the residents in real time. This support is in addition to our regular clinical behavioral health services. We also have a behavioral health specialist on site dedicated to staff needs who is proactively reaching out to the staff on the 2 units that have been impacted to provide support and coping mechanisms. The behavioral health specialist is also available to all staff, and our clinicians will continue to reach out to provide services. I know, that caring for our most vulnerable during this pandemic is some of the most intense and selfless work in the city. I am grateful to the professionalism, compassion, and perseverance of the Laguna Honda team. They are true heroes. With regard to infection prevention and control, Laguna Honda continues to receive the support and expertise from the Centers of Disease Control and Prevention, with experts on site, including infection control nurses, infectious disease physicians, and epidemiologists. The CDC continues to guide Laguna Honda in screening and retesting of staff from the 2 quarantine units. The CDC experts, in collaboration with Laguna Honda's staff, is conducting thorough contact investigations to look for sources of infection and the potential pathway of further spread. This will inform our current actions and further development of outbreak prevention and response that takes the coronavirus situation fully into account. The CDC has also developed a web tracking system for every staff person that is identified as symptomatic during screening or who calls in sick. This data will be instrumental in limiting the spread of the virus, but also providing important data as staffing levels and duration of illness among staff for COVID-19 and other infectious diseases. The CDC is also developing an app-based form of this system to facilitate staff self-screening prior to arriving at work. Under CDC guidance, Laguna Honda has improved an infectious prevention and control program using some of the best practices from top experts to be integrated into day-to-day operations. These include all aspects of operations, from deep cleaning of infected rooms to transfer of acute patients to the screening of staff. We are taking the knowledge and the learnings from the CDC and rapidly applying them through establishing trainings, learning modules, and real-time coaching to ensure that Laguna Honda has these expert protocols in place, regardless of the on-site presence of the CDC. And I am most grateful for the CDC's support and expertise. This is an ever-changing situation, and the ability to develop and rapidly implement best practices and protocols will help us slow the spread of this virus, not only at Laguna Honda Hospital, but also at other residential nursing facilities in the city and the region. Again, I want to thank the staff of Laguna Honda, the residents, and their families for their resilience and their capacity to be part of our response to this pandemic. Thank you very much. Director Trent Rohr of the Human Service Agency will now make remarks.
Good afternoon. I'm Trent Rohr, the director of the Human Services Agency in San Francisco. I want today to give everyone an update on our plan for hoteling, as well as providing other housing and supports for individuals during this pandemic. As I have said before, the Human Services Agency is charged with providing care and shelter for the city's residents under this pandemic. On March 9th, our agency activated our Emergency Operations Center in the expectation that we were going to need to respond in a massive way to provide rooms and other housing options for individuals under COVID. Under the mayor's leadership, we met early on with the Hotel Council, which is the group of hotel owners in San Francisco representing over 80 hotels in the city, to describe what was facing us and to ask for their assistance in stepping up and providing hotel rooms for the most vulnerable people in San Francisco. The response to our request for bids was overwhelming. We received responses from over 45 hotels representing more than 10,000 rooms. And these rooms were listed in the RFQ to be provided to the following populations. The first population are individuals who are COVID positive or persons under investigation, meaning they have been tested and the test results are not yet in. And in addition, these are individuals who cannot self-quarantine on their own, meaning their current housing situation does not allow them to quarantine on their own. So that would be individuals who are in our SRO or single room occupancy hotels, where they share bathrooms or kitchens or eating facilities. There's about 19,000 individuals living in these situations in San Francisco. In addition, of course, our homeless population who live in homeless shelters, who are on the street, clearly are unable to self-quarantine. So the second population that these hotel rooms will be provided for are vulnerable populations who are in our homeless shelters, and also vulnerable populations who are homeless and on our streets. These are individuals that are age 60 and above, or who have underlying health conditions for whom a COVID positive would result in potentially significant harm to them. And the third category for hotel rooms are, of course, our frontline health responders. Principally, we want to make sure that they remain healthy and able to provide the essential services and healthcare and supports for our San Francisco residents, that they don't go home and potentially infect their families, or go home and get infected from their families or their communities. So I want to now give you an update on our progress so far at bringing these hotels under contract. As of today, we have 1,977 hotel rooms under or near contract. 880 of these are for first responders. 1,097 of them are for the vulnerable populations that I just listed a minute ago. The current numbers in hotels, we have 184 individuals who are in the vulnerable class in hotel rooms, and 67 first responders. Of the 184, the vast majority of individuals in these rooms are homeless. As I say every time I'm describing the city's response to care and shelter, this is an extremely fluid situation, and we're responding seemingly daily, or often more than once daily, to differing guidance from the CDC or the State Department of Health, as well as the Department of Public Health. The current plan, based on the most recent evidence and data and information from those health authorities, is that we need to bring on about 7,000 hotel rooms for the populations I described above. So our plan is to do that. We have begun our costing out of the plan, and I want to talk to you a little bit about those figures now. The current 1,977 rooms we have under contract will cost the city about $35 million over the first 3 months of activation. The plan for the 7,000 units, 7,000 hotel rooms, will cost over $105 million over that same 3-month period. So in a sense, our total activation or plan of 7,000 rooms will cost approximately $105 million. This cost does include estimates for staff costs. It does include estimates for supplies, for cleaning, and the other essential elements that we need to bring on the hotel rooms. It's important to note that FEMA provided guidance to the state of California that they will reimburse states and localities up to 75% of the costs of these hotel rooms, but only for specific populations. The populations that FEMA will provide that 75% reimbursement for are those who are COVID positive or persons who have come in close contact with someone who is COVID positive, individuals who have underlying health conditions that I described earlier, and individuals age 65 and over is what will be covered at 75% by FEMA. I'll note that our plan in San Francisco, we consider age 60 and above to be vulnerable, and so there will be a segment of the population we bring into hotel rooms that will not be reimbursed by FEMA. In addition, the state of California, through the governor, has provided across the state $150 million to counties to help cover the cost of these hotel rooms. San Francisco will, of course, receive a share of that $150 million to be applied towards the $105 million costs that I mentioned a minute ago. Lastly, I want to mention our plans for our sheltering. This is probably the one piece of our response that has been the most fluid. Initially, when we activated on March 9th, the plans across the state were to open additional shelters in order to thin out our shelter populations. Subsequent to that, and I'll say that we had planned for 2,500 shelter beds in order to do this. As an example, the city of Los Angeles is standing up 46 rec centers totaling over 6,000 shelter beds in early mid-March. More recently, from the State Department of Health, we've received guidance that congregate shelters are not an appropriate response. We have experienced that in San Francisco. As you know, we've had COVID positive or COVID outbreaks at 2 of our shelters. We immediately shifted gears and pivoted from using Moscone North as a shelter to reduce the population in our existing shelters. And instead, Moscone North will serve as a shelter for medically cleared homeless individuals, really as a step down from our hotel rooms. They have been tested negative, or they had acquired COVID and they have since recovered and been tested clear. If they choose to, they can receive a slot at the Moscone West shelter with the appropriate physical distancing as well. The second shelter that we are setting up is at the Palace of Fine Arts. It has room for 160 individuals. Because this response is so fluid, what we are doing is setting up this shelter in order to be able to respond to whatever need that may emerge. We're currently not planning on moving individuals into that shelter at this time, but we have that under agreement, and it makes sense to have a relief valve of 160 slots for individuals should that need arise. We are in constant conversation with the Department of Homelessness and Supportive Housing, the city's Department of Public Health, regarding the potential use for this space. So I just want to wrap up again by restating the populations that we're providing hotel rooms to, so we're clear. COVID positive and persons under investigation, meaning they've had a test and need to be quarantined and they can't at home. Vulnerable individuals who are on our streets and in our shelter system in order to reduce the population in our shelters and also in order to provide them a safe place so they are protected from the virus, and then our first line responders. We are planning for 7,000 rooms for that purpose. And as I said, we have nearly 2,000 rooms under contract now. So now I will turn the podium over to San Francisco's Police Chief William Scott. Chief Scott.
Good afternoon, everyone. I'd like to begin with thanks and a show of appreciation to our mayor for her leadership during this crisis, particularly in the resources that have been provided to our first responders, our police officers, and members of the San Francisco Police Department, other first responders, and other city employees. We've had many members that have had a lot of stress and anxiety related to this pandemic, and the resources that the mayor has described today will be extremely helpful in helping us to deal with this pandemic and the anxieties and stresses that go along with that, and also in terms of increasing our resiliency to do what we need to do to keep our communities safe and healthy. So I thank the mayor and everybody that had a part in making this happen. By taking care of our first responders and our city employees, we know that we'll have a safer and healthier San Francisco, and we will be in a position to help the residents of our city. So thanks again for that work. I want to speak a little bit about our compliance in the city overall. We are still seeing really good compliance, and that's been mentioned by the mayor and others, including Dr. Colfax, but we still do have some challenges. The statistics that I provided for you on Monday, as far as citations, are still valid. We still have 2 citations, and those were on individuals. But I want to provide an update on the other statistics. I reported Monday that we had issued 26 warnings or admonishments. That number has increased to 41, so 15 additional admonishments. The majority of the additions have been to businesses that are deemed to be non-essential. And again, we are tracking, taking reports, and as I said, we will not ask a second time. So for those businesses that are operating, we do understand, and we're very empathetic to the fact that this is uncharted waters for all of us, and this is impacting people's livelihoods, and there's a degree of stress and anxiety that goes along with that. But we need people to think of what we're trying to do here, and what we're trying to do here is save lives, to keep people alive. So please comply and adhere to the public health orders, and let's keep doing well as we have seen for the first 3 weeks of this order. As far as crime, we are still seeing downward trends in terms of our rates of crime. I want to go in a little bit more detail than I did the other day in terms of our crime statistics for this past week. 24% decrease in violent crimes, and that's a decrease of 19 crimes, 71 the week before and 58 this week. Our property crimes, we saw a larger decrease. We saw a decrease of 146 fewer property crimes, and that number went from 569 to 455. Our Part 1 overall crimes, we are down 165 week over the prior week. So we are seeing these decreases, but we want to emphasize that our officers are out in force, they're out patrolling the streets, and we'd like to see that trend continue. Particularly, we're focused on the businesses that are boarded up and closed. We know that those businesses feel vulnerable, and those owners feel that their businesses are vulnerable, and so we want to pay extra attention to that. We have had some burglaries and vandalisms of businesses. We've made arrests, and we will continue to patrol those areas so we can give some sense of comfort to those folks that have had to close down their businesses during this pandemic. We encourage all people to report crime when they see it and if they see it. And there are some crimes, as I mentioned in past press conferences, that you can report either online or call our call center. If it's a crime of violence or a crime in progress, a serious crime in progress, please call 911. Continue to do that. We will respond, and one of the silver linings in this whole thing is that traffic is very light, so our response time has really gotten much, much better because of the light traffic. So we will be there if you call us. For crimes that have already taken place and for non-violent property crimes, please call our non-emergency number at 415-553-0123. You can also call 311 or utilize our San Francisco Police website to file a police report or request an existing police report. I want to reemphasize some of the scams that we've been hearing about. I'm pleased that we have not had this particular one that I'm about to describe to you in our city, but we're seeing it online and hearing people talk about it, so we want to advise and warn the public so people can remain safe. We've had a number of online posts about people knocking on doors, asking to come into residences and residential communities, and these folks are claiming to be Center for Disease Control Workers or San Francisco Department of Public Health workers. Again, I want to inform the public that workers from the San Francisco Department of Public Health or workers from the Center for Disease Control will not knock on your door and ask to come inside your house or your residence. So please don't let people in. If you get that, it's not legitimate. So please be aware, be informed about that, and call 911 if that happens to you. We do have our city disaster service workers who are placing door hangers on businesses and doors. So be aware of that. And these are informational pamphlets in multiple languages. And that is to keep the public informed and help with the cause of staying at home and staying 6 feet apart and the social distancing requirements that we've all been asked to do. But they will not ask to come inside your residence if they hang a flyer. So please make note of that. And if you have somebody that is reporting to be a worker from any of those entities or any city worker for that matter, do not let them into your home. If it sounds too good to be true, it probably is. So as we always say with scams, don't fall for things that sound too good to be true. Investigate it. Call somebody that you trust if you're not unsure. And these particular individuals like to prey on our elderly victims and our most vulnerable populations. So please be aware of that. And if you know someone in those demographics, please spread the word and help so we don't have anybody taken advantage of. Robocalls, emails, online sellers are also sources of scandalous activity and scams. So please be careful and not fall prey to that. If you're asked to click a link that you're unfamiliar with, please be cautious about that and investigate the sites that you're going into to make sure you're not being scammed that way. And also, if you are receiving online type of fraudulent or scam activity, you can call the Federal Trade Commission at 877-382-4357. That's 877-382-4357. As the mayor said, we expect that the weather will be nice this weekend, and we believe that the weather has played a part in helping keep some of the people off the streets in the past few days. But as the weather increases, we are asking again, please comply with the public health orders, the social distancing requirements. If you have to go out for essential shopping like groceries and pharmaceuticals, stay 6 feet away from the person in front of you or the person behind you. It's really important. And we're asking that the store managers and owners and the leadership at these particular outlets help out with that cause as well, as they are required to. The last thing I'd like to say is just for the overall health of the police department and wellness, we are doing well. Nothing to update on there. And again, I'd like to thank our mayor, Mayor London Breed, our Director of Public Health, Dr. Grant Colfax, for their outstanding leadership during this pandemic. Let's keep our foot on the pedal. Let's do what we've been asked to do, and let's all stay safe and healthy. Thank you.
Thank you, Chief. Our first questions will be for Dr. Grant Colfax. Dr. Colfax, this question is from Janie Haar at the Associated Press. Last week, Trent Rohrer said that 123 people, of whom 95% are homeless, had been moved from hospital beds to hotel rooms because they had tested positive and needed to isolate, or they were awaiting test results. Why are these people not counted in the city's overall number of homeless who have tested positive for COVID-19, which is 3?
So let me clarify on that number. Currently, we have 167 people who have been moved out of the hospital who are either COVID positive or people under investigation. Those include people who have no other place to go that is safe. That would include a high proportion likely of homeless individuals, but also include people who are in crowded living conditions, SROs and other places where they cannot go and safely isolate. So it's a combination of those populations. Again, that's a very important intervention so that we can keep our hospital system as open as possible. With regard to the people, the 3 people who were mentioned, we actually have 4 cases now of people who have been diagnosed in either a shelter or navigation center. The MSC South Center now has 3 diagnosed cases, and the navigation center has 1. We are working hard with our data systems to provide a more accurate number of people experiencing homelessness who have been diagnosed with COVID-19. I just want to also emphasize that the testing is done throughout the city by a number of different providers, including private labs. Our understanding at this time is that private labs do not assess the housing situation of people, but within our DPH system, we are looking to merge data sources on status of living status and COVID positive cases, and we hope to be able to share that information. Thank you.
The next question is from Trisha Tandandi of the San Francisco Chronicle. Will the city release specific data on how many COVID cases have been tied to skilled nursing facilities or long-term care facilities? And if so, how many cases have there been?
We will be releasing those data as they are made available, and we compile and ensure that they are accurate.
And then a follow-up. Yesterday, we learned that at least 1 skilled nursing home, the Campus for Jewish Living, is preparing to accept COVID patients. How many skilled nursing facilities in San Francisco are opening their doors to COVID patients?
So the state is working with individual long-term care facilities, helping determine which facilities, both across the state and within San Francisco, could do that with regard to the need and ensuring the safety of staff and residents. I am not able to identify these facilities specifically in San Francisco out of respect for privacy. I will say that as part of our surge planning, assessing and determining where COVID positive patients who require a skilled nursing type level of care has always been part of our conversation with our other health systems in the city. And we are supporting the long-term care facilities in our collective response. We have regular communication with them. We're supporting them. And we also hope to be able to apply apply the CDC recommendations from Laguna Honda to our other partners in the city.
Question from Ron Lin of the Los Angeles Times. Do you expect the shelter-in-place order and forms of social distancing to last beyond the summer and into the fall or into next year?
Well, unfortunately, I cannot predict the future. I'm focused on what we know now, looking at the data, science, and facts. And what we know now is the shelter in place, the social distancing, also known as physical distancing, appears to have slowed the spread of the coronavirus in San Francisco. And this is a very vulnerable and pivotal time for us to ensure that surge continues to be slow. As you can see from the data tracker, there has been a steady increase in both cases and hospitalizations, and we must be resolute in our focus in continuing the social distancing per the shelter-in-place order during this time.
And a follow-up from Mr. Lin. Why are we seeing rising hospitalization cases even though the shelter in place was enacted more than 3 weeks ago?
Well, this virus is extremely transmissible. So despite multiple efforts, early actions, we always knew that there were going to be cases of COVID-19 in our city, unfortunately. And what we are focusing now is ensuring that our hospital systems have capacity to provide the best care possible for people with COVID-19. Yes, there's an increase. There's an increase across the United States. Unfortunately, in our 7x7 city, we do see a pattern. But if you look across the nation, our increase has been slower so far. But again, this could change any day. When this virus takes off, it can really take off. So I would go back to the public health interventions, the social distancing, ensuring that you're washing your hands, ensuring that you're wearing a face covering. If you cannot keep 6 feet, at least 6 feet away from individuals, please do that and exercise restraint in your outings. Thank you.
Final question for Dr. Colfax from Joshua Sabatini of the San Francisco Examiner. Since the first cases were diagnosed, has anyone recovered from COVID-19? And if so, how many people?
So people do recover from COVID-19. And I think we know from the data, both nationally and internationally, that the majority of people, and many people have mild symptoms and recover well. It's really our focus needs to be on these vulnerable populations, the people who unfortunately have to be hospitalized, the people who are in the ICU. I think the focus really needs to be on our hospital system and the capacity there. And unfortunately, the people who have not recovered are unfortunately the people who have died. And we have those 10 people. But with our health system, with our collective efforts at prevention, and with our experts, and I want to emphasize the incredible expertise we have in the health department at Zuckerberg San Francisco General, UCSF, Dignity, Sutter Health, Kaiser, and others. We have incredible leadership focusing on ensuring that as many people recover as possible.
And a follow-up from Josh Sabatini. Is the department doing contact investigations for every positive case and notifying those who may have been in contact with the positive case?
So we are continuing to expand our contact investigation efforts, and we are ensuring that we are focusing on the most vulnerable communities with those contact investigations. Right now, our capacity to do all of the contact tracing for every case has simply been exceeded, which is, again, why we are focusing on ensuring that there is social distancing, physical distancing, and capacity. But as we move forward, we are ensuring that we have a robust number of contact investigators on board. Think of right now as a situation where we have, as you can see from the dashboard, we have lots of community transmission. Over time, our hope, I do not know if this will happen, but over time, we hope that due to the efforts of physical social distancing and other efforts, that community transmission rate will decrease, and we will go to a level where the contact tracing is particularly important. So think of it now as a situation where there is a steady, unfortunately steady, fire throughout the city with regard to transmission of cases. If we are successful in extinguishing this broader fire across the community, then we think about, in the next stage, if we get there, sparks in the community, sparks, cases, outbreaks that are containable. So our goal is to have a robust team of disease control investigators who can immediately respond to those sparks so we do not return to a situation where we have widespread community transmission today.
Thank you, Dr. Colfax. The next two questions are for Mayor Breed. Mayor Breed, this question is from Stephanie Sierra at ABC 7. SF Pride Parade organizers have not yet officially canceled the event for June. Organizers said it may still happen. Do you have a response to that?
Well, I do, and I want to just start by saying Pride is one of my favorite times of the year in San Francisco, and especially during this pandemic. The fact that the Pride celebration potentially may not happen will be devastating to not only me personally, but I know to so many people in our city. But we're in a different reality, and I think it's important. First of all, as Dr. Colfax said, we can't predict the future. We don't know what's going to happen here in the city as this progresses, but we do know that when we start to get out of this, that having large scale events will be very, very difficult. So I am not certain that it will be possible at this time to say whether or not we can move forward with Pride in the same capacity as we have done for many, many years. I think that once the shelter in order is lifted, there is going to be a gradual process to get the city back on track and back into some level of normalcy. And I think it may not be possible to expect that we could launch a large-scale event with millions of people descending on San Francisco. I just am not sure if that's going to be realistic to expect that we will be able to host the kind of Pride parade that this city is known for. And so that's where we are at this time.
Next question is from John King of the San Francisco Chronicle. What will Mayor Breed do if the emergency legislation proposed yesterday at the board is approved, which would include taking homeless people of all ages and current conditions and placing them in hotel rooms?
I think I want to be clear that from the very beginning, we have really focused on moving forward plans that are realistic, that allow us to use data, that are sustainable, that allow us to not only provide the resources necessary to make them work, but to also sustain them. We have had to basically make magic happen over the past month as it relates to setting up this emergency operations center in order to focus on the public health crisis and staffing up our hospitals, making sure that our nurses and doctors have protective equipment, making sure that our city workforce has protective equipment, making sure that we're thinning out our shelter systems and doing everything we can to protect the people who are actually working in our shelter system. So we know that it's a lot more complicated. As I said, you know, the thing that I would want to do more than anyone else is be able to house every single person who's on the street to make sure that they have a safe place to be. But the fact is that comes with so much more than opening up the doors and giving people a hotel room. Trent Rohr, the Director of Human Services, had provided an overview with a clear plan that has been changed based on what we know may work and may not work. Specifically, the change we made to Moscone West, the changes we're making around the hotel rooms that we are fortunate enough to have access to, and the need to provide the kind of staffing for those particular locations that will ensure safety, that will ensure that when we provide a room to someone, that that person is the only person who is in that room, or that person with their family members. That we are working with the hotels, that we are providing the 24-hour care and support, laundry service, food, and all of the things needed. And that takes a lot of people. And it takes a lot of people who are part of our workforce. And the reality that we're in is that some of those people are afraid. They're afraid to come to work. And we want to make sure that when we set these systems up, we are not only providing places for people to be during this crisis, but we are providing protection for those we are expecting to put their lives on the line. We are expanding our capacity significantly quickly, and that takes a plan that is focused, that is developed, that is consistent, that is something we can actually deliver. And that is really what is important for me as mayor of the city to focus on, is what we know we can do and to make sure we get it done, and to focus our attention on elevating what we know we need in this crisis. And I will really basically continue to do just that.
Thank you, Madam Mayor. The next questions are for Trent Rohr.
Trent Rohr, Human Services Agency.
This is a question from John King of the San Francisco Chronicle. To clarify, the 7,000 hotel rooms do not include any rooms set aside for homeless who are not COVID-19 positive and are not ranked as part of the vulnerable population. No, quote, ordinary homeless, so to speak.
Let me clarify again. The 7,000 rooms that we are bringing online are for COVID positive, persons under investigation who can't self-quarantine, and vulnerable homeless individuals who are living in shelter or on the street. Vulnerable defined as age 60 and above, or with underlying health conditions that would make them more susceptible to the COVID virus. So let me reiterate, 7,000 includes homeless on the street, homeless from shelter, as well as COVID positive and persons under investigation for COVID.
Thank you, Director Rohr. The next questions are for Chief Bill Scott. Chief Scott, this is a question from the San Francisco Chronicle. Has there been any change in calls related to domestic violence? Has there been an increase as suggested by anecdotal evidence?
Well, I can tell you what's been reported to the San Francisco Police Department. We've actually seen a decrease in reported domestic violence incidents. And from the period of March 17th to March 31st is the latest reporting that I have. Compared to that time last year, we had 121 reported domestic violence incidents as opposed to 179 for the same period last year. Now, I will qualify that by saying we're hearing from some of the groups and advocate groups that they've had an increase in calls, and that might be a good thing in that people are seeking out help. We know from the science of human behavior that stress and anxiety as well as frustration can trigger violent behavior. So my message to the public is if those things are happening, please seek out help. You know, the mayor has said it, public health professionals in our city and across the country have said it. Please seek out help. But as far as reported, we've seen a decrease for this shelter-in-place, stay-at-home period as of March 17th through March 31st. So we'll keep an eye on that. And it's definitely something that our police officers and our investigators are attuned to. And again, some crimes are not reported, and we realize that, but it's another opportunity for me to encourage people to report crimes when they happen. We will be there and we will investigate. Thank you.
Thank you, Chief. The next questions are for Abigail Stewart-Kahn. These are the last two questions of the press conference, and they come from Brian Howie of San Francisco Public Press. Has the city run into any challenges transitioning into hotel rooms unhoused people with mental health, substance use, or general trust issues? And if so, how are city agencies handling these challenges?
Thanks for that great question, Brian. I know that from talking with you that you feel how I feel, which is that people experiencing homelessness are just like you and me. We all have questions and worries now, and we would all need support if we were asked to pick up and leave our communities and move into an unknown hotel room. As a social worker, I know that the strength of every person is what we need to rely on now, and I see it as the system's responsibility to set up that support so that we can rapidly meet people where they are. We have steps in place and staff from all over the city who are trained to evaluate an individual's ability to self-care in these new environments before they move. The city is coming to help us. Our hotels are staffed with HSH heroes, nonprofits, First United Council, and now ECS of San Francisco, and many more on the way, as well as disaster service workers from city partners. As we scale, we will be reaching out to the most vulnerable outside through all of the channels we've already established and with a careful and clear process in place. We're grateful to IHSS, which is a part of DOS and the Human Services Agency, who've come to help so that people can be empowered to self-care. And we are excited that we're exploring a volunteer program that would allow people at home to regularly check in on individuals living in hotels, to reduce isolation and support on-site staff. We believe in San Francisco and in our community to set this up so people can shelter in place. It's going to take all of our creativity and our strength, but we're built for this. Thank you.
Follow-up, is the city working with any homelessness-related outreach groups to transition people into hotel rooms? And if so, which groups and what role do they play?
I think I understand the question. I'll answer it as best I can. As we move to, as Director Rohr said, we are working on both sheltered and unsheltered homelessness as defined by the Department of Public Health, most vulnerable, 60 and over, and people with pre-existing conditions. We will be working with the homeless outreach team and other organizations, but we are not ready for that yet. So we will be providing more information in the coming days as to how we will be bringing unsheltered individuals inside. Right now, we are very focused on getting to shelter equilibrium, and particularly those sites with COVID-positive cases. We are getting to scale rapidly, and we look forward to providing further updates. Thank you.
Thank you very much. That concludes our press conference.